I'm Dr. Rita McGuire. I'm the Chief Medical Officer and one of the co-founders here at Wakana, and I represent the pillar of health. And every Wednesday, we have some exciting discussions on different chronic illnesses that maybe you or maybe you have a loved one that is being challenged. We talk about that chronic disease, and then we also talk about how CBD can assist with the symptoms that are causing challenges. So the entire month of July, we're talking about something called the clinical endocannabinoid deficiency syndrome. So let's first talk about what is the endocannabinoid system. Just a recap for those who may have missed the first 2 Wednesdays of the month. But the endocannabinoid system is a biological system. And what's so fascinating about this system is that everybody has an endocannabinoid system. If you have a spinal cord, you have an endocannabinoid system. And this system is deemed the most vital regulatory system in our body. It consists of compounds called cannabinoids. It consists of receptors. It controls our cognitive responses, so how we think, how we react, our memory, our mood. It controls our appetite. It controls our fertility. It controls pregnancy. It controls pre- and postnatal development of the fetus. It just controls our overall internal balance. And what it does is it is the way that cannabis works in our body. So it mediates, it modulates actually the science or the pharmacology of cannabis in our body. So what are these compounds? Well, they're called cannabinoids, and they are a class of chemical compounds that act on these receptors that are found through our entire body. The 2 cannabinoids that the plant makes, and we'll get into that discussion a little bit more a little later, is THC, or tetrahydrocannabinol. It's the compound that gives us the high. It gives us the euphoria. It gives us that paranoia. And then there's CBD, or cannabidiol. It is non-intoxicating. It doesn't give us the high. It gives us the health benefits without the high. And so what you can see in that slide is that there's over 120 compounds that the plant makes, and each one of these compounds have medicinal properties on the body. And then we have compounds that our body makes. Yes, our body actually produces cannabinoids just like the plant. They're called endogenous cannabinoids or endocannabinoids, and they're naturally produced by the body. So the 2 most common ones are anandamide and 2-AG. And when these 2 cannabinoids are deficient in our body, then we have a clinical endocannabinoid deficiency. And that causes a really big problem. So let's first talk about anandamide. It's one of the endocannabinoids that is an essential omega-6 fatty acid. In fact, it is a neurotransmitter. So it sends messages to the brain to help to modulate and regulate stress, anxiety, depression, pain. In fact, this word is derived from a Sanskrit word, ananda, which means bliss. It means joy. It means delight. So anandamide is the compound that gives us joy, that gives us bliss, that makes us feel good. And then we have 2-AG. 2-AG is another endocannabinoid that our body produces. In fact, it's the most abundant one that our body produces, and it has a lot of benefits on the body. In fact, it regulates appetite, It regulates the immune system and how it functions. It regulates pain management. It regulates the circulatory system, so your blood pressure and your pulse rate. It also suppresses seizures. And it is found abundantly in breast milk. So if you know any breastfeeding moms, or if you breastfed your baby, then your baby was introduced to endocannabinoids at birth. So that is 2AG. So when we look at the receptors within the endocannabinoid system, these receptors, as you can see in the slide, is found throughout our entire body. From our head to our toes, there are receptors in the body looking for cannabinoids. They're looking for cannabis-based compounds to put our body back in balance. So we have CB1 receptors. Those receptors are typically found in the brain and the central nervous system. They regulate and modulate motor activity, thinking, appetite, memory, pain perception, and they're also found in the immune cells. And then there's CB2. CB2 are found in the gut, the kidneys, the pancreas, the muscles, the eyes, the reproductive tract, the respiratory tract, the skin, the central nervous system, the liver, the heart. So these receptors keep our body in balance when the endocannabinoids in our bodies attach to it and send messages to the brain and other parts of the body. So this particular endocannabinoid deficiency was discovered by Dr. Ethan Russo. And every Wednesday, I tell you that you don't want to miss the very last Wednesday in the month, because he will be joining me. Yes, the person who discovered this syndrome will be joining me with a really, really interesting conversation on July 29th. So you don't want to miss that. You really want to invite all of your guests to bring all this information together. And what he found when he discovered this deficiency is that there were deficiencies not only in the receptors, but also in the endogenous cannabinoid. And when that deficiency happens, what he found was that depression was a real issue. Anxiety was a real issue. We'll talk about other issues when these deficiencies occur. So not only is there an issue sending a signal to the brain or to the periphery or to the immune system, but there was also an increase in response to several diseases when we saw all of these deficiencies happen. So they believe that the clinical endocannabinoid deficiency happens as a result of not enough endocannabinoids being produced, not enough receptors that are responding, so the body cannot function properly. It's unbalanced. It's not in homeostasis, which allows for diseases to arise. So that's why cannabinoids are really important. And if your body is not producing cannabinoids sufficiently, this is why everybody needs CBD, that to supplement your endocannabinoid system. So what are some of the symptoms that we see in folks who have clinical endocannabinoid symptoms? Well, they struggle with insomnia. How many of you on the line struggle with insomnia? They struggle with anxiety. They struggle with conditions that are associated with inflammation, like arthritis and lupus and gout. They have anger management issues. You know, their mood is not stable. They suffer from depression, bone loss, chronic pain, dementia-like symptoms, and even carry a very strong family history of cancer. So we've talked about some of the diseases that make up the clinical endocannabinoid deficiency. We've had a conversation about migraines, fibromyalgia. Tonight we'll be talking about irritable bowel syndrome, but other diseases that are linked to this syndrome is causalgia or allodynia. We're going to talk about what that means. It's really a heightened pain that occurs in people that should not be so heightened. There is that phantom limb pain. Maybe you've had surgery. Maybe you've had an amputation and you still have that pain associated to that particular limb. Infantile colic, glaucoma, dysmenorrhea, which is very painful menstrual cramps, hyperemesis gravidarum, which is nausea and vomiting in pregnant women, unexplained fetal wastage, which is multiple miscarriages, PTSD, bipolar disease. These are just a few of the medical diseases that are linked to the clinical endocannabinoid deficiency disease. So tonight we're going to concentrate on irritable bowel syndrome. Irritable bowel syndrome is a very, very common GI disorder. In fact, it is a #1 reason that GI docs see so many patients for irritable bowel syndrome. It's a spastic colon. And unfortunately, it's idiopathic, which means we don't know what the disorder, it's an unknown cause of this disorder. So it's called idiopathic. It affects the large intestine. In fact, 10 to 15% of US adults have irritable bowel syndrome. It's severe cramping, severe abdominal pain, severe bloating, lots of gas, and an alteration of either constipation or a lot of diarrhea. So it is a very hypersensitivity that the large colon experiences, which causes a lot of pain. Risk factors. Well, it occurs more frequently in people under the age of 50. It's more prevalent in females, unfortunately women, because of a hormonal imbalance. Either it happens before or after menopause. There's a big family history that is related to irritable bowel syndrome, runs in families. It can either be a genetic or an environmental reason. Mental health problems are a real issue. Risk factors, we find those who have anxiety and depression and other mental health issues have a higher risk of irritable bowel syndrome. A history of sexual, physical, or emotional abuse also is related to be a risk factor for irritable bowel syndrome. Now, the causes that we see, we told you it's idiopathic. They really don't know what the cause of irritable bowel, but what we see is that there is a very, very intense, abnormal muscle contraction within the intestine. See, when you eat food, the food should be broken down and the intestinal tract will contract so that stool can ultimately come out through the rectum. Well, in irritable bowel syndrome, there is abnormal contractions. They're very intense and they're not normal. There's even abnormalities in the nerves, in the digestive system. So the nerves are very sensitive. There's inflammation. There's an increased number of immune system cells within the intestine. There's even severe infection. It typically develops after a severe bout of diarrhea or what we call gastroenteritis, and there's changes in the gut flora. So we know that people who have a lot of infection and they take a lot of antibiotics, well, antibiotics, yes, may address an infection in your body, but it also kills off the good bacteria in our gut that is needed to have a healthy system. So research indicates that people with inflammatory bowel syndrome typically don't have a healthy microflora like other folks. So we see that the triggers of irritable bowel syndrome are food. You know, there could be a food allergy or a food intolerance, either to wheat or dairy. I tell you each and every week that dairy is of the devil. Gotta take dairy out of your diet. A lot of citrus fruits can be triggers. Beans, cabbage, Like I said, milk and other carbonated drinks. Stress. We see that stress worsens and we see more frequent bouts and signs and symptoms under stress. And then hormones. Again, women are twice likely to have irritable bowel syndrome because of hormonal changes around our menstrual cycle and even the lack of estrogen in menopause. So those are some of the triggers that we see. Complications, I mean, just imagine having severe, chronic, long-term contractions of your intestinal tract, having long-term diarrhea or bouts of constipation. It causes the quality of your life to be very poor. So these people have poor quality of life. They're missing a lot of days from work. I mean, you know, if you have a GI upset, you can't go to work if you have chronic diarrhea. So these people miss 3 times as many days from work due to their symptoms. And then the mood disorders, you know, these folks experience signs and symptoms of extreme depression and anxiety because they're in so much pain. How do you diagnose irritable bowel syndrome? Well, we said that it's idiopathic. The disorder is of unknown origin. There's no physical signs or pathognomonic signs, meaning that you can't look at a person and say they have irritable bowel syndrome. There's a lot of disease entities where you can look for physical signs, you know, like in rheumatoid arthritis, or maybe in sickle cell. You have the jaundice of the eyes. With irritable bowel syndrome, there is no physical signs. Even diagnostic procedures, you know, your doctor may have you undergo a colonoscopy or a barium study or a lab test. There's no signs that really help us diagnose irritable bowel syndrome. So it's a really debilitating, painful, chronic disease that causes a lot of issues. The treatment, well, we've got self-care, you know, making sure that you're on a high fiber diet, physical exercise, you know, stress reduction, mindfulness, meditation, prayer, relaxation techniques. There's medications that we typically prescribe, anti-diarrhea medications, gut antispasmodics. If you're constipated, a laxative, nerve pain medications, gabapentin we may recommend. If there's a lot of inflammation or if there's a lot of bouts of gastroenteritis, antibiotics, but that's a catch-22, right? The more antibiotics you give someone, you're causing the flora and killing off the good bacteria in the intestines. Dietary supplements, there are therapies like biofeedback, there's cognitive behavioral therapy, and even brief psychotherapy may be recommended. But what's really interesting, a little nugget for you, is that cannabis, CBD, has been an effective treatment in the 19th century for GI disorders like cholera. So cannabis was like the #1 medication that was used back then in the day to really help to calm down the intestinal tract. So why is irritable bowel syndrome included in this clinical endocannabinoid deficiency syndrome? Well, it's included because irritable bowel syndrome is a hyperalgesia. That means that the pain is turned up to the 11th dial. So these people have a very hypersensitivity to pain that really shouldn't cause them to have a poor quality of life. It's called allodynia. It means that you feel pain from things that really shouldn't hurt. See, these folks with irritable bowel syndrome may have someone brush by their stomach and they have extreme debilitating pain. They have inflammation in the nervous system or the digestive tract. They also have central sensitivity, meaning that the central nervous system is hyperreactive and very sensitive to the messages that are sent from the HPA axis. I don't know if you were on our 710 conference, but Dr. Natasha Gettings talked about the hypothalamic pituitary axis that's part of the stress response system. So there's a dysfunction in this axis in inflammatory bowel syndrome patients that causes them to have a very hypersensitive reaction to pain. So when we look at the clinical endocannabinoid deficiency, we see that folks that suffer from migraines, fibromyalgia, and irritable bowel syndrome, they kind of commingle. Sometimes they overlap, and these people have all three at the same time. So this study was a study that was done by Dr. Ethan Russo, where he documented that when you have a deficiency in the anandamide, when you have a deficiency in the 2-AG, when your receptors within the endocannabinoid system are also deficient, that this causes an increased incidence in migraines, fibromyalgia, and irritable bowel syndrome. For some reason, in these disorders that are treatment resistant, meaning we really don't have medications that we can really help folks with, if you give these folks cannabis and cannabis-based medications, they improve. And this is documented in several studies. This is just one of the studies that I wanted to share with you. So it's fascinating that you can even enhance your endocannabinoid system with foods. You can eat dark chocolate or increase your essential fatty acids or take in hemp seeds and hemp oil and flaxseed and chia seeds and walnuts and sardines and anchovies and even eggs. So there are ways that you can make your endocannabinoid system more receptive to your CBD when you're looking for a holistic, natural way of addressing symptoms due to irritable bowel syndrome. There's even other things that you can do to stimulate your endocannabinoid system. And one of those things is exercise, counseling, biofeedback, yoga. You know, there's a lot of studies that show that anandamide, an endogenous cannabinoid that our body produces, increases when we exercise, when we do yoga, when we pray, when we do mindfulness meditations. Other things that stimulate your endocannabinoid system are terpenes, and terpenes are found in our CBD products as well as CBD. So again, there are natural, holistic ways to stimulate your endocannabinoid system, especially when you're dealing with a disease where the disorder is really from an unknown origin or idiopathic. So now let's get into our product line here at Wakana. And our product line is amazing. And not because it looks beautiful, but it's because our products work. Our products are tested. We're going to talk about why that is important. So a little bit about our company. The name of our company is Wakana, and we're much more than a CBD company. We're a movement. You know, our whole vision is that we exist to end the negative stigma. And we want to end the negative stigma because when you speak about CBD and you talk about cannabis, you know, people think that we're talking about getting high or weed or marijuana or reefer. Tonight, you're going to learn about the part of the cannabis plant that gives us the health benefits without the high. And because of this negative stigma, it's really caused communities around the world to really suffer out and lose out on what this plant can offer as it relates to health. Our mission, you know, you may be on the webinar tonight and you may be trying to figure out, how do I become part of this cannabis industry or this movement? So we are a catalyst to really help and to inspire people to confidently move into the legal space. You may be interested in locking arms with us as an entrepreneur, or maybe you're interested in formulating or even investing. So we really are here. Our mission are to invoke the courage and strength of people like you to take back their health, wealth, legacy, and freedom through this plant. Now, I want to quickly introduce you to the leadership here at Wakana, our co-founders. Melissa Boston is our CEO. She is the visionary behind Wakana. She brings to us over 29 years of experience, not only in direct sales, but in corporate America. In fact, she fired her boss at the age of 32 and a half years old, but she truly is a leader in direct sales. In fact, she's built over 40 companies in 40 countries. She's trained over 50,000 distributors. She's a social media strategist and the visionary behind Wakana. Our president, Dr. Patricia Van Pelt, is a state senator right here in Illinois, serving her third term. She's a businesswoman. She's an evangelist. And Phyllis Nash, our senior VP of sales, is what we call our midwife. She births all of the possibilities that we have here as it relates to a business in our industry here of CBD. She brings to us over 30 years experience, not only in real estate, but in the restaurant business and the liquor industry. And then myself, Dr. Rita McGuire, I'm actually an obstetrician gynecologist. I've been an obstetrician for over 30 years. But more importantly, I've been in the cannabis industry, as all four of us have, since 2017. In fact, I was one of the physicians that the governor of Illinois called upon to testify for the legalization and taxation of adult use cannabis here in Illinois. So all four of us bring you experience. We're experts and pioneers in the CBD space. So let's talk about the plant a little bit more, because I really want you to understand the difference between marijuana and hemp. And it's really important to understand the difference between marijuana and hemp, because our products are sourced from the hemp species of the cannabis plant. See, the cannabis plant has two species, marijuana, which has high levels of THC. That's the part of the plant that gives you high, gives you that paranoia, euphoria. And then there's hemp. That's a species that gives you high levels of CBD and trace amounts of THC. In fact, the legal limit of THC in hemp is 0.3% or less. So our products are sourced and extracted from the hemp species. So in 2018, CBD, which was extracted and comes from hemp, was legalized. It was finally legalized after 80 years of prohibition, many years since the war on drugs in the 70s, to be legally on a federal level consumed, cultivated, and sold in all 50 states. So CBD stands for cannabidiol. Again, it is the part of the plant that gives you the health benefits without the high. So it's not like THC, but it is the health part of the plant. Really important to understand that distinction. It has a lot of benefits on the brain. Again, not giving you the high, but giving you the health by reducing psychosis, reducing depression, reducing anxiety. It's an antioxidant, meaning that it helps to balance those free radicals that cause a lot of diseases in the body. And it's neuroprotective. It's neuroprotective, meaning it can decrease, again, the inflammation in the central nervous system. So when we look at the Farm Bill in 2018, the Farm Bill, again, is a agricultural bill that allows hemp to no longer be a Schedule I or a controlled substance. So this is what makes it legal. This is what allows us to sell our product in all 50 states. Again, it's coming from the hemp plant, which contains less than 0.3% or less of THC. So we look at the other cannabinoids or the other compounds that the plant produces. But you can see here in the slide, CBD or cannabidiol has many, many medical or medicinal benefits. The other compounds like CBG and CBC and delta-9 THC absolutely are very important and are found in our products, but it's the CBD that has more of the medicinal benefits, helping to relieve pain. We talked about how the pain is exacerbated in folks who have inflammatory bowel disease. They have an increased sensitivity to the nerves that feed the digestive system. They also have a lot of muscle spasms or contractions of the intestinal tract. That causes a lot of anxiety. CBD helps to relieve anxiety. It also helps to relieve inflammation. It helps to relieve psychosis, seizures. It helps to manage blood sugar. It helps to reduce the risk of arterial blockage. So CBD does a lot. In fact, there's 20,000 peer review articles that after you get off this webinar tonight, you can do your own due diligence. Use your own favorite search engine and look at all of the medical benefits that CBD has. And again, it works by the endocannabinoid system. It works by the receptors in the body that are found throughout the entire body that is looking for CBD, looking for the other cannabinoids to bind, to send a message to the brain, to send the message to the intestinal tract, to stop contracting so hard, to stop causing so much pain, to stop causing so much inflammation. So there's real science about how CBD works in the body, specifically the large intestine, to improve the symptoms for those who have irritable bowel syndrome. So again, the FDA does not allow us to make any claims. The FDA does not allow us to make any promises that CBD can mitigate or treat or to even cause someone that has irritable bowel syndrome to not have it anymore, to cure it. But what we can say through the studies that I just shared with you with Dr. Ethan Russo is that CBD can help alleviate the symptoms that irritable bowel syndrome causes, right? It can help with the symptoms that irritable bowel syndrome causes. It can help with the symptoms. We can't make any claims, but it can help with the symptoms, and research and data has shown that. So in 2018, when the Farm Bill was passed, guess what happened? There were CBD companies popping up everywhere. There were people making CBD in garages and basements. We were finding CBD as you can today in gas stations. You can find CBD in video stores, but not all CBD is made equally. In fact, here at Wakana, we have products you can trust. Why? Because we provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, and our products are Farm Bill compliant. We talked about the 2018 Farm Bill, which states that CBD extracted and coming from the hemp species is legal on a federal level in all 50 states. Again, as long as it contains the legal limit of THC, which is 0.3% or less. We also provide certificates of analysis on all of our products. Certificates of analysis is critical in this marketplace. Our certificate of analysis allows a consumer like you to see what's exactly in the bottle, to ensure that the product is free from mold, mildew, heavy metals, pesticides. That when we say there's 500 milligrams in the bottle, a third-party validation lab validates that for our consumers. So really, really critical, that certificate of analysis. So let's talk about some of our products quickly. One of our top products is our Hempranium 500 milligrams. This is a tincture. It's a CBD oil, and what that means is that you place it under the tongue and you hold it under the tongue for a minute so that the CBD oil can be absorbed in the bloodstream. Now, this is a great product for someone who is trying to seek relief to symptoms that are caused by irritable bowel syndrome, because now we are feeding the endocannabinoid system that is deficient. We're addressing the inflammation, we're addressing the pain. We have a proprietary formulation which includes not only 500 milligrams of CBD in that 15 ml bottle, but we also have enhanced our CBD with black seed, turmeric, and peppermint. Well, these are 3 USDA organic certified essential oils that help to enhance the anti-inflammatory properties that we talked about that CBD has, that actually enhance the pain and analgesic properties that CBD has. And it also, peppermint is very good for the digestive system, as well as black seed in aiding in digestion, and turmeric that's aiding in inflammation. So when you start CBD, you start low and you start slow. You start with 3 drops twice a day, because even the Mayo Clinic did a study. And when they did this study that looked at folks who had chronic debilitating pain, and what they found is that those people with chronic debilitating pain didn't need any more than 2.5 to about 50 milligrams of CBD on a daily dose. So 3 drops in the morning, 3 drops in the evening of this particular product will give you about 10 milligrams of CBD. And that's a great way to start, because more is not better. If that doesn't resolve the symptoms that are due to inflammatory bowel syndrome, you can increase it to 8 drops twice a day, a maximum dose of 15 drops twice a day. So that's our Hempranium 500. We talked about the debilitating pain that those who have irritable bowel syndrome have. They have muscle contractions, they have abdominal pain and bloating and a lot of gas. Well, our topical relief will aid in local relief that you may need. This is a great product to rub on your abdomen. It is 200 milligrams of CBD. It also has 8 USDA certified essential oils. Again, a proprietary formulation where we have taken our CBD and enhanced it with essential oils that also aid in reducing inflammation, that also aid in reducing pain, and also aid in those who have symptoms related to irritable bowel syndrome. So this is a great product that you can use as needed. You don't need a lot. Again, more is not better. A little goes a long way. And then our CBD joints and cartridges. What I love about these products as it relates to irritable bowel syndrome is during those times when you have symptoms of acute onset of inflammation and pain, you can address that very quickly. Within 1 to 5 minutes of taking 1 to 3 pulls on either our CBD joint or our cartridges, that CBD can get into the bloodstream very quickly. Our CBD joint is 106 milligrams of CBD. That's why 1 to 3 pulls is enough. You don't need 106 milligrams of CBD all at one time. Our cartridges are the same, 1 to 3 pulls for an acute flare of muscle contractions or abdominal pain or bloating is all you need. So I love these products because they are fast acting and work very, very well. And then our gummies. Our gummies are, again, a great way to get CBD into your system. When we talk about chronic long-term conditions like irritable bowel syndrome, I really like for folks to combine all of our products. So combining the tinctures or the oil underneath your tongue, along with one of the fast-acting products like the cartridges and the pre-rolls, along with the gummies. Now the gummies take about 30 to 90 minutes to get into the bloodstream. That's why gummies are really good to take at night, so they can address those issues with insomnia. They can address issues with inflammation. They can even address those issues with pain. A lot of folks with irritable bowel syndrome lose sleep because they're in pain, because the large intestine is causing such severe contractions. Each gummy is 25 milligrams. And what's so unique about our gummies is that our gummies are infused, they're not coated. So we just don't have a gummy that has CBD on the outside. The CBD is infused with the other cannabinoids so that they're more potent. These gummies are also vegan and non-GMO. So it's always good to start low and slow. Start with half a gummy. Work yourself up to one whole gummy. More is not necessary. Now, our power gummies, again, contain 0.3% or less of THC. And I want to remind you, all of our products that have the black label or all of our power products contain the legal limit of THC, which means if you are at a job that you undergo possibly a random drug screen, we'll talk about those pure products. Those are the products we want you to take. Our power products, gummies, come in a 4-count pack or they come in a 20-count bottle. And then we have, again, our empowered hair. Our empowered hair is another great product for those who we see with inflammatory bowel syndrome. A lot of these chronic illnesses, because of the inflammation, they do attack the hair follicle. This is a product that addresses hair thinning, hair loss. It's a product that can be used topically, which means you can use it right in the scalp. And that's a great way for those who have random drug screens, because whenever you use a topical product, like our topical pain cream, like this empowered hair, it does not pass the blood-brain barrier. It does not get into the urine drug screen. You can also use this product, empowered hair, and you can ingest it. You can put it underneath the tongue. You can hold it for 60 seconds. Again, it's a great way to address symptoms that inflammatory bowel syndrome sufferers can have, which is hair thinning and hair loss. And then our culinary line. Our culinary line is a great way to get CBD in your system, right? Through our seasonings. I want to concentrate though on our Power Water Soluble. This is a product that you can use in your food, in your beverages, in your smoothie. I love the Power Water Soluble because you may be dealing with someone that is in such extreme pain that holding the tincture under their tongue for a minute is not something that is a doable thing. So our Power Water Soluble, you can drop in your water, your food, your beverages, your smoothie. Again, 3 drops twice a day is a great way to start. We have a culinary oil you can bake and cook with. We have a CBD culinary oil that you can marinate your fish, your chicken. You can use it just like you use olive oil. So cooking with CBD is a great, great, exciting way to get CBD into the system. Now let's move on to the products for those who may be on the webinar that have random drug screens at your job. We have a pure line, which is our broad spectrum line of products, which contain less than 0.0% or less of THC. It also has a special technology called nanotechnology, which is just a delivery system, meaning that it allows the CBD molecule to be more water soluble, which makes this product more available or bioavailable to the cell. This is a 300 milligram product in a 15 ml bottle, which means that you're getting about 1 milligram per drop. So if you do 3 drops twice a day, you're getting 6 milligrams on a daily dose. So 6 drops in a day is a great way to start. You can also increase that to 8 drops twice a day, maximum of 15 drops twice a day. I can't stress enough that when you're dealing with symptoms due to irritable bowel syndrome, start low and start slow. Start low and start slow. We also have the same gummies in our broad spectrum or our pure products. Now, each one of our pure gummies, our new gummies, are 20 milligrams of CBD. Again, gummies are great to take at night, right? So you're addressing inflammation and pain and painful bloating and abdominal pain during the day. And then at night, you want to make sure that that gummy is on board so that you can sleep. So you have that restorative sleep. You wake up rested. These pure gummies, our new gummies, are 25 in a bottle, 20 milligrams each. Our gummies are vegan, non-GMO, and they are infused and not coated. Our new gummies come in a 5-count pack. So that means 20 milligrams times 5, you're getting actually 100 milligrams in that 5-count pack. So what's really, really great is that we can offer you, if you're a guest on the line, you can offer our customers our products at a savings. We have all of these products packaged very nicely in something that we rolled out as our 710 essentials. We have a 710 power essential, which means these products are a combination of our power products, our power gummies, our power hempranium, our diamond pre-roll, that CBD joint, our power water soluble, and our pain relief cream. And what I love about these packages is that you can see here that you're saving over $121 when you buy packages versus buying a la carte versus buying them individually. So this is a special sale offer for the entire month of July, $157.10. We also offer a variety pack. That means we offer our broad or our pure products with our power products. So this 710 variety essential pack comes with that broad spectrum gummy bottle. It also comes with a bottle of the power gummies. It comes with that empowered hair, the extreme relief, and the power water soluble. All the products you would need for someone who's looking for relief from symptoms from irritable bowel syndrome. Again, a savings of over $117 when you buy that essential pack. We offer a 710 Pure Essential for those who are on the line that may have random drug screens at their job. The Pure Essential comes with 2 broad spectrum gummies, 1 of the pure hempranium tincture, 1 empowered hair, and 1 extreme relief cream. Again, when you use the topical products, they do not pass a blood-brain barrier. They do not cause a positive urine drug screen. So packaging these, again, This particular one saves you over $100 when you buy it in our 710 Pure Power or Variety Essential Pack for the entire month of July. So hopefully you understand how critical it is when someone is dealing with the endocannabinoid or cannabinoid deficiency syndrome, and how we can help those to supplement their cannabinoid system, either through diet, through stress management, and with our amazing CBD products. Again, I can't stress enough a healthy diet. We talked about how you can enhance that, how CBD becomes really magical when you have a good diet, when you have a diet that is not processed, fried foods. All of those things cause irritable bowel syndrome, those symptoms, to be worse. When you combine that with exercise, what does exercise do? Well, exercise increases anandamide, yoga, cycling, swimming, walking, running, all of those things improve our endogenous cannabinoids and those receptors within our body. I do always mention this. We have a weight management Facebook page where I do free coaching. So if you are on the line and you suffer from symptoms of irritable bowel syndrome and you come on as a customer, I will coach you. I will help you to get your body back in balance. So you need a referral. You need a referral from one of our business partners to be a part of my free weight loss coaching. So I'm going to take questions right now, but I want to remind you, if you're on the webinar and you want to know more about the business, you want to join our overview tomorrow evening at 8 p.m. with Minister Mooney, our overview at 8 p.m. That is the dial-in, the same dial-in as tonight, and there is the Zoom link. Whoever invited you on the line can give you more information as far as that overview is concerned. Right now, I'm going to take questions. I really would love those questions to be centered on irritable bowel syndrome or any of the other endocannabinoid deficiencies that we've talked about. We've talked about fibromyalgia. We've talked about migraine. Want you to put those questions right in the chat box, or you can put those questions in the Q&A box as well. So the first question is Crohn's disease a irritable bowel syndrome disease? So Crohn's disease is very much like irritable bowel syndrome. The difference is that irritable bowel syndrome really doesn't have any lab testing or imaging that can make that diagnosis, whereas Crohn's disease does. Same sort of symptoms, chronic bouts of diarrhea or constipation, extreme debilitating pain. So yes, someone with Crohn's disease and those symptoms that Crohn's disease causes would get much relief from CBD and the products that we talked about. Again, we can't make claims. We can't make any diagnosing claims, mitigations of treatment, but what we can say is that the research has shown that CBD has been very, very helpful since the 19th century in helping with GI disorders, like one of the big ones back then, which was cholera. Another question. I have irritable bowel syndrome and the gummies are the only thing that stops the cramps. Thank you, Wakana. Awesome testimony. Thank you for that testimony. So we know that, the gummies are very, very potent and very effective because they're not coated. They're infused. So using gummies for any of the symptoms that we talk about irritable bowel syndrome sufferers suffer from, Gummies are very, very helpful. I like combining the products, the gummies with the tincture or the water soluble, along with one of that fast acting pre-rolls or the cartridges. That's why those products are also included in those 710 essential packages. Any other questions? How is anandamide different from serotonin in terms of their functions? Great question. So anandamide is a neurotransmitter, just like serotonin. Anandamide has receptors in the brain and central nervous system, CB1 receptors that are sending a signal to the brain. Serotonin has the same receptor sites and pathways in the central nervous system. Serotonin really plays a big role in mood. Serotonin and dopamine play a big role in the central nervous system with sleep, with pain management, as well as memory. So it's a great analogy. They are both neurotransmitters, they're both chemicals, they both have receptors that help to modulate and regulate our mood. So you want to make sure that when you're looking at clinical endocannabinoid deficiency syndrome diseases like anxiety and depression, what do we see? We see a decrease in anandamide and you see a decrease in serotonin. And that's what's fascinating about Dr. Ethan Russo. In 2003, when he discovered all of these issues, he actually measured the anandamide level in folks who suffered from depression. And what they thought was a serotonin deficiency actually is an anandamide deficiency. So that's why when the body cannot produce enough anandamide or enough 2-AG, that's when we see disease states, anxiety, depression, irritable bowel syndrome, migraines. All of these conditions improve when we supplement our endocannabinoid system with CBD. Great, great questions. Thank you, Dr. Rita, for another week of great information. If I were to run out of hempranium tincture, would I be able to replace it with the hemp-powered hair under the tongue? Absolutely, you can. The hemp-powered hair, though it doesn't have 500 milligrams of the CBD, it will give you relief. So you may have to increase the amount of drops for the hemp-powered hair. But what I love about hemp-powered hair is that hemp-powered hair has about 19 essential oils that help to enhance the CBD. So you're getting a lot of the same benefits from the hemp-powered hair as you do the Hempranium 500. But just know that you may have to increase the dose with the hemp-powered hair. The hemp-powered hair is placed underneath the tongue. You're holding it for 60 seconds before you swallow. Any plans in the future to offer products with THC for all the conditions mentioned? Well, we are a CBD company. So if you're asking about marijuana, medical marijuana, Wakana would not be offering those sorts of products. So Nakia, if I didn't answer your question, you can rephrase it, but it sounds like you're asking about medical marijuana. Great info. I didn't know CBD could help all of these conditions. Let's see what questions we have on the Q&A side. Dr. Rita, what can I suggest for someone with sciatica nerve condition? Well, sciatica nerve condition is a condition where the sciatica nerve is inflamed. It causes a pretty bad pain that radiates from the gluteus maximus, your buttock, all the way down your leg. So again, when you're dealing with inflammation, CBD is an anti-inflammatory. The tinctures, the Hempranium 500, the topical, the CBD topical pain relief, the CBD pre-roll for that acute inflammation, the gummies, that 710 pure or power pack, essential pack is the way to go to address symptoms due to sciatica. You notice that I always say symptoms due to something, right? Because the FDA does not allow us to say that these products can cure, treat, or mitigate any disease, but the symptoms due to that disease. How does CBD work with diverticulitis? Same thing. Diverticulitis, itis. Whenever you see the word itis at the end of anything, that means inflammation. Inflammation, CBD is a powerful anti-inflammatory. So it can be inflammation in the colon, the small or large intestine. It can be inflammation in joints. It can be inflammation in the brain. It can be inflammation in the blood vessels. It can be inflammation in the pancreas. Wherever there is inflammation, CBD can come in and reduce the inflammation. So diverticulitis, same thing as inflammatory bowel disease, very painful, very debilitating. Quality of life is effective. When quality of life is affected, there is depression, there's anxiety, there's insomnia, right? So the tinctures, the fast-acting products, the pre-roll, the cartridges, the gummies, the topicals, all of those products are found in our 710 essential package, where we'll address the symptoms due to diverticulitis. Great questions tonight. Keep them coming. Keep them coming. Keep them coming. So I want to make sure that you contact the person that invited you on the line so they can get you your 710 essential package, be it the pure, power, or variety. That's really the best savings that you're going to have versus buying the products a la carte. If you have any additional questions, you can always contact me at ritamd@wakana.com. I'm going to put that in the chat. That is my email address. Again, thank you for joining this evening. We want you to contact the person that invited you this evening so we can get those products ordered and in your hands. Thank you again. Have a great night. We'll see you next Wednesday for part 4 of clinical endocannabinoid deficiency. Remember, we're going to have the founder of the clinical endocannabinoid deficiency on the line July 29th. You don't want to miss July 29th. Put that in your calendar right now so you don't forget. Have an amazing rest of your evening.